Okay, John has a couple of more questions that probably have a similar answer, but are there timelines and goals established for each of the priority groups?
No, and again, when you speak of priority groups, definitely we have made healthcare workers,
Mm-hmm.
first responders have been given priority during the rollout of testing, um, largely because testing kits were very scarce initially. Kaweah Delta did not have the ability to do our own in-house testing. We could collect the specimens, but we had to send them to the county, to their laboratory to be tested. And so we had to be, you know, just very cautious with how we were using the supplies because we want to make certain that our employees, our physicians, our residents, those who are taking care of patients, we don't want to put patients at risk. So we needed to have the ability to prioritize them, to be able to test them first. But as testing kits have become more and more plentiful, and we have two different testing platforms, one called BD Max, the other is the Abbott ID Now, both extremely sensitive, accurate, give us relatively quick results. Those testing supplies have become increasingly available. We have about 5,000 test kits across those two platforms. So we are starting, obviously, to use more now that we're testing surgical patients and endoscopic patients. But we also, if anybody is out there in the community and they're exhibiting symptoms, we refer them to either call the county to go through the screening process, and they'll refer them to Kaweah Delta, or call your primary care physician. So a community physician can write an order to have their patient tested. They'll be sent over to the Kaweah Delta specimen collection site on Floral, and then we will run the test on our platform. So with the availability of greater testing, we're now expanding out more and more into the community.